Welcome to the Lesson 7 of the Green Skills for Nurses Planetary Health course by EFN. This lesson is all about quality assurance in planetary health nursing. Lessons 7 and 8 are closely connected, as quality assurance in planetary health and the analysis and reduction of the healthcare sector's environmental impact go hand in hand. Lessons 7 and 8 are centered around Core Competency 6, which involves independently ensuring the quality of and evaluating nursing care, and the Core Competency 8, which is about analyzing care quality to improve one's own professional practice. Healthcare has numerous impacts on the environment, and these, in turn, affect human health. In the Lesson 7, we will shine a spotlight on healthcare waste, encompassing solid waste, pharmaceutical waste, and wastewater. This waste can be avoidable and poses not only environmental but also human health risk. Lesson 8 will mainly delve into greenhouse gas emissions originating from the healthcare. Throughout both lessons, remember to apply the planetary health lens to gain a broader perspective. Consider how these factors impact the air patients breathe, their natural status, mental well-being, long-term disease risk, and even the origin of the resources and materials used in your hospitals. The image you see is a part of an art installation by Dutch artist Maria Koik. She collected all the materials used and discarded during her mastectomy after diagnosed with breast cancer. Hospitals generate approximately half a kilogram of waste per hospital bed per day. This amount can vary based on the type of ward, the illness treated, and the hospital's location. With perfect waste separation, 15% of the total waste generated is hazardous, encompassing infections, sharps, or toxic materials that require incineration. Hospital waste often comprises numerous single-use and plastic items. These plastics are employed as food contact materials used in the close proximity to patients and sometimes even implanted in patients' bodies. Shockingly, plastic has been found within human blood, and the plasticizers are in these materials, which provide flexibility, can potentially leach into food or patients' bodies. This is especially concerning for neonates and prematurely born children, as their low body weight results in a high dose of toxins per kilogram. Here you see the zero waste hierarchy, illustrating how to manage waste to achieve the lowest possible amount. Prevention is the most effective strategy. It involves rethinking and redesigning products and refusing to use them if unnecessary. The second best option is the reduction and reuse, which entails using fewer items and reusing those that can be repurposed. Some items may need to be prepared for reuse, often involving sterilization. Recycling and composting are less desirable options, as recycled materials are often of lower quality and typically cannot be recycled again. Finally, materials and chemicals can be recovered, meaning they are extracted from the original item, allowing at least part of the item to be reused. Hazardous healthcare waste is typically incinerated, rendering it possible to reuse, recycle, or recover. Additionally, incineration leads to emissions and air pollution. While single-use items may appear cost-effective in the short term, they have long-term environmental, financial, and health-related consequences that are unsustainable. The ultimate goal is the transition to a circular economy in the healthcare. According to the World Health Organization, this transition offers a significant opportunity to yield substantial health benefits, both directly for healthcare systems and indirectly by reducing negative environmental impacts. The extensive use of natural resources threatens to exceed the planet's carrying capacity. The concept of a circular economy presents a path to sustainable growth, good health, decent jobs, environmental conservation, and responsible consumption and production. This shift entails moving away from a linear economy characterized by a take, make, dispose approach and embracing a circular economy that prioritized renewal, remaking, and sharing, ultimately promoting responsible consumption and production. Another significant category of healthcare waste is pharmaceutical waste, which has environmental and health implications at every stage of its life cycle, from production and use to disposal. Key concerns include environmental contamination and pollution, antimicrobial resistance, emissions, and energy consumptions. Please take a moment to watch the following video, which sheds light on the issue of pharmaceuticals in environment. Now, let's delve into the world of quality assurance and sustainable quality improvement, the SUSQI, in planetary health nursing. Quality improvement in the healthcare is a systemic approach to making changes that can lead to better patient outcomes, enhanced efficiency, and improved processes within healthcare settings. In essence, it's about making healthcare better, safer, and more effective. Quality improvement often follows structured cycle known as the PDSA cycle, which stands for plan, do, study, and act. Let's break down these components. First of all, plan. In this phase, healthcare professionals identify a problem or an area that needs improvement. They set specific, measurable, achievable, relevant, and time-bound goals. For example, an hospital might aim to reduce the amount of pharmaceutical waste it generates by 20% within the next 6 months. Second, do. This phase involves implementing the planned changes on a small scale. It's a testing phase where the proposed improvements are put into action. In our pharmaceutical waste reduction example, the hospital might start by piloting a new system for medication dispensing and waste management in one unit. Study. After implementing the changes, healthcare professionals collect and analyze data to assess the impact. Did the changes have the desired effect? What were the outcomes? Did they encounter any unexpected issues? For our hospital, this phase might involve tracking the volume of pharmaceutical waste generated in the test unit and evaluating whether it met the 20% reduction target. The last point is act. Based on the result and insight from the study phase, healthcare teams decide whether to adopt, adapt, or abandon the changes. If the pharmaceutical waste reduction pilot was successful, the hospital might decide to implement the new system across all units. If there were issues, They might refine the approach and conduct another cycle of improvement. Now, how does this relate to the SUSQI? Sustainable quality improvement applies these principles of quality improvement, but extends the focus beyond traditional measures of quality to incorporate environmental, social, and financial factors, the triple bottom line. It aims to maximize health benefits while minimizing financial cost and harmful environmental and social impacts. In our pharmaceutical waste example, the SUSQI would not only consider the reduction in waste but also assesses the ecological and social implications of the changes, such as the environmental benefit of reducing pharmaceutical pollution, the benefit of preventing AMR, and the potential cost savings for the hospital. It's important to understand that the SUSQI doesn't replace standard quality improvement practices. Instead, it enriches them by integrating sustainability considerations into the process. The ultimate goal is to make sustainability and natural and integral part of healthcare quality improvement. For those interested in delving deeper into the SUSQI, you can find more information and resources at the Center of Sustainable Healthcare. At the conclusion of this lesson, take a moment to reflect on whether you have observed any unnecessary waste in your daily nursing practice. Have you noticed unsustainable waste disposal practices? Think about ideas for a sustainable quality improvement project that can make a positive impact.